Imagine a simple adjustment in medical practice that could potentially save hearts from failing. But here's where it gets controversial. What if giving blood transfusions earlier than the current standard could reduce heart failure and irregular heartbeats in patients with heart disease, without increasing the risk of severe complications? A groundbreaking study presented at the American Heart Association's Scientific Sessions 2025 in New Orleans suggests just that, challenging long-held beliefs about transfusion timing. And this is the part most people miss. It's not about giving more blood, but about when that blood is given. Research highlights timing matters, but not for severe complications. Administering blood transfusions earlier, when hemoglobin levels drop below 10 g/dl instead of the standard 7 g/dl, did not increase the risk of severe outcomes like death, heart attack, kidney failure, stroke, or the need for heart procedures. This finding alone is a game-changer for post-surgery care. Heart health benefits. However, the study revealed that earlier transfusions were linked to a 41% lower risk of heart failure and irregular heart rhythms in patients with heart disease. This is where the debate heats up. Could earlier intervention be a heart saver for high-risk patients? Published and peer-reviewed. The study, simultaneously published in the prestigious journal JAMA, adds weight to its findings, though it's important to note that further research is needed to confirm these results. The study in action. The transfusion trigger after operations in high cardiac risk patients. Top trial involved over 1,400 U.S. military veterans undergoing major general or vascular surgery. Researchers compared two transfusion strategies. One triggered at hemoglobin levels below 10 g/dl, early, and the other at below 7 g/dl, late. The goal? To determine if earlier intervention could prevent complications in heart patients. Key findings. Severe complications. Rates of severe complications were nearly identical between the early, 9.1%, and late, 10.1%, transfusion groups, suggesting that earlier transfusions don't worsen outcomes. Heart-specific benefits. Heart failure and irregular heart rhythms occurred in just 5.9% of the early transfusion group, compared to 9.9% in the late group. This significant reduction raises a critical question. Are we waiting too long to act? Why this matters? Lead author Dr. Panos Kougias explains. For people with heart disease, the timing of a blood transfusion is critical. Our findings suggest that earlier intervention may protect the heart from the strain of blood loss, much like keeping a car's fuel tank above half full instead of waiting for the low fuel warning. The controversy. Traditionally, doctors have hesitated to transfuse blood too early, fearing it might overload the heart. But this study flips the script, suggesting that persistent anemia might actually strain the heart more than the volume added by a transfusion. Is this a paradigm shift in how we treat high-risk heart patients? Limitations and future directions. The study primarily involved male veterans, so its findings may not apply to women or more diverse populations. Additionally, the number of severe complications was lower than expected, meaning smaller differences might have gone unnoticed. What do you think? Should earlier transfusions become the new standard for heart patients, or is more research needed? Study details. Participants, 1,424 U.S. military veterans, mostly men, 98%, with an average age of 70. Duration. Enrolled between February 2018 and March 2023, with 90-day follow-ups. Funding. Supported by the Veterans Affairs Office of Research and Development. Final thoughts. This study challenges us to rethink transfusion strategies, especially for patients with serious heart conditions. While a one-size-fits-all approach may not be ideal, earlier intervention could be a lifesaver for some. But here's the question we leave you with. Are we ready to embrace this change, or does the medical community need more evidence to act? Share your thoughts in the comments. Let's spark a conversation that could shape the future of heart care.